Thank you so much for joining us for today's Hawaii Pacific Health webinar focused on survivorship, prevention through nutrition. My name is Valerie Ferguson, and I'm here to facilitate today's conversation. We've assembled an expert panel of speakers to help provide guidance to support cancer survivors, those looking to prevent cancer, and mindful eating tips as we approach the holiday season. Before we get started, a few reminders for our viewers. Today's webinar will be recorded. After the event is complete, registered participants will receive an email at a later date with a link to the recording. The event will also be available to view on our social media channels and website. For those joining us live, please feel free to submit questions using the Q&A button at the bottom of your screen. We will do our best to answer as many questions as we can during the Q&A portion of the event. Our first speaker of many experts joining us for today's discussion is Dr. Jamie Fukui. She is an associate professor at the University of Hawaii Cancer Center and provides services through Hawaii Pacific Health Oncology. Her interests are in breast cancer clinical and translational research, developing clinical trial protocols, and providing cancer care to the residents of Hawaii. Dr. Fukui will be talking about inflammation in cancer, lifestyle recommendations for prevention and recovery.
Hello, so today I'm going to be talking about inflammation and its contribution to cancer. The overall outline of my talk, I'll be going over what inflammation is, some of the history, risk factors for cancer, including inflammation, obesity, and what we can do about it, physical activity, diet, and I'll briefly mention some studies. In 1863, a German physician, Dr. Rudolf Virchow, noticed that there were some white blood cells in cancerous tissue, and we call that inflammation when there's a lot of white blood cells in a tissue. And he noticed there's a link between inflammation and cancer development. Then over 100 years later, a pathologist and vascular researcher, Harold Dvorak, noticed that there were certain white blood cells that were activated at the site of injury. We know that when there's trauma, when there are wounds, that white blood cells go to that site to help. But tumors were wounds that did not heal. And so that was clearly showing that there's a link between inflammation and cancer development. Fast forward now, chronic inflammation has many different disease-promoting states, such as cardiovascular disease, like atherosclerosis and stroke, ocular disease, like retinopathy, autoimmune diseases, such as psoriasis and rheumatoid arthritis, pulmonary disease, like COPD, neurodegenerative diseases, like dementia and Alzheimer's, periodontitis diseases, which I'll get into a little bit later when we talk about gingivitis, metabolic syndrome, type 2 diabetes is included under that, fatty liver disease, as well as chronic kidney disease, all can contribute. Age-related fragility, such as neuromuscular dystrophies, as well as osteoporosis. And then finally, cancer. We know that there's some chronic inflammatory states that can contribute to cancer development, such as lung cancer, kidney, colorectal, pancreas, lymphoma, and others. So there's a real balance between a pro-inflammatory immunity where there are cellular transformations from regular cells to cancer cells that promote tumor growth and that shape the tumor microenvironment to become pro-tumor. On the other hand, there are anti-tumor immunities where the immune system will surveil the whole body and make sure that the tumors stay dormant or that they don't grow. And immunotherapies are really helpful in this to booster the anti-tumor immunogenicity in the body. There are several hallmarks of cancer where we know a cell has to develop into cancer if it has certain signals, and one of them in red is an anti-inflammatory or an inflammatory microenvironment. There are also other key aspects of cancer that are listed here, but the one we're going to focus on is the inflammatory microenvironment that predisposes people to developing cancer. There are a number of contributing or risk factors that can develop into cancer. Some of them we can change, some of them we can't change. The ones listed on the left cannot be changed. Age, how old we get. As we know, cancer gets more and more common as we get older. Our environment that we're born into or that we live in, our genetics, and the hormones that we have, as well as our immune status, and then the daily radiation we may or may not have received. Some things can be changed, however, such as obesity, physical activity, diet, and nutrition, which we're going to focus on today, but also alcohol, tobacco use, infectious agents such as different infections can increase someone's risk of cancer, as well as sunlight or UV light exposure. So if we look at some of those external factors that are, or triggers that are mentioned there, our Western diet is very pro-inflammatory, as well as the radiation and the UV exposure we might have received. There are certain chemicals that can lead to a local inflammation, as well as smoking and alcohol use. There are some microbial and viral infections that we know can develop into cancer, some of them being very common, such as HPV, which can increase someone's risk of cervical cancer, hepatitis B and C, which can increase someone's risk of liver cancers, and Epstein-Barr virus, which can increase risk of head and neck cancers. There are also some infectious diseases known as H. pylori, which can increase someone's risk for gastric cancers. And so it's listed next to it, these internal triggers. We give the example of the gastrointestinal tract, where from the mouth all the way down, there can be different types of local inflammation that can contribute to various types of cancers. So if we go to the top all the way to the bottom, you can see inflammation of the esophagus, of the stomach, of the gallbladder, of the pancreas, and all of those can be triggered by various things externally to become internal triggers, and that can increase someone's risk of those different types of cancers. So inflammatory bowel disease is a common one that can increase someone's risk of colorectal cancer. Now, if we zoom out a little bit and we look at overall systemic factors, just aging and obesity in and of itself can contribute to a systemic inflammation, immune dysfunction, which overall can predispose someone to developing cancer. So I'm going to briefly mention obesity and how about 13 cancers are associated with being overweight and obese. And they're listed here on the right-hand side. About 40% of all cancers are associated, and that number is increasing. So from the brain, thyroid, breast, specifically in postmenopausal women, the esophagus, the liver, gallbladder, stomach, which we mentioned before, as well as pancreas, the kidneys, and in women, uterus, ovaries, as well as colorectal. There is a rare blood cell type of multiple myeloma can also be increased with obesity. So how does it exactly cause cancer? Well, obesity, there are several different ways that it can cause cancer, and one of them is a chronic low level of inflammation that can cause DNA damage, which can predispose people to developing cancer. So fat cells, they can release estrogen, which can increase the risk of breast, endometrial, or uterine and ovarian cancers. The fat cells can actually make extra hormone and growth factors. And when those are released in the body, they tell the cells to divide more often and grow. And that increases the chance of cancer cells being produced, which can then continue to divide and cause a tumor. There are other types of substances in the blood that can be released, such as insulin and insulin-like growth factor 1, that may promote colon, kidney, prostate, and again, uterine or endometrial cancers as well. So this is one way that obesity can contribute to chronic inflammation, which can contribute to cancer development. We do know that for people who've had cancer, there are various treatments that they've had: surgery, chemotherapy, sometimes radiation, and sometimes in breast cancer, anti-hormone or endocrine therapies are given to help prevent risk of recurrence. And we know those treatments can affect various aspects of the body and can cause various side effects. We know that these are short-term for the most part, and so although there is slight increase in inflammation, it is not a long-term effect of inflammation, although there can be long-term side effects. So it's important to address these through various things such as diet and exercise. But even though we utilize radiation, for instance, for treatment, that does not mean that it is contributing overall worse to breast cancer or cancer outcomes if somebody has radiation, because that's short-lived inflammation. That is, again, trying to rebalance the body and make sure that it's treating the cancer cells, but not causing too much inflammation for cancer development in the future. One way that we can really help to not only prevent cancer, but improve side effects and overall outcomes of cancer is to have higher levels of physical activity. We know it's linked with lowering of several different kinds of cancers that are listed there, as well as decreasing a number of other cancers listed on the right in men. So this is very important not only to help with reducing risk of cancer, but also to help combat some of the side effects of cancer treatments. There are several programs that are free or low cost for cancer survivors. There is one at the Rehab Hospital of the Pacific in combination with collaboration with University of Hawaii Cancer Center and UH Manoa, looking at breast cancer survivors and exercise, as well as overall cancer survivors and exercise. And then there's one at Kapiolani called the Stay Strong Oncology Rehab Program, which also helps to get people motivated. Sometimes it's hard to do physical activity every day. The recommendation is 150 to 300 minutes a week of some moderate level of activity, or if it's more rigorous activity, it's 75 to 150 minutes a week. Sometimes that can be difficult, and so these programs are really here to help to develop a routine so that someone can continue 2 to 3 times a week of physical activity. And these are monitored by a healthcare professional as well. I want to briefly mention nutrition, quality, and quantity, although we're going to have further lectures that are going to go more in depth. But we know our nutrition, quality, and quantity are so important and can influence inflammation and immunity in the body, which can contribute to aging and overall cancer development. So in general, the dietary recommendations are to have a variety of vegetables, of fruits, and a variety of colors. So I really like this picture because it shows a lot of different varieties. We want to avoid processed red meats, sugary sweet drinks, highly processed foods, as well as limit alcohol intake. So in moderation, about 1 or less drink a day for women or 2 drinks or less a day for men. One thing I also want to mention before we wrap up here is that stress management is so important. We know that stress can contribute to chronic inflammation. And so coping with chronic stress is vitally important, not only through exercise that we've mentioned before, but practicing having boundaries, saying no. In addition to nutritional changes, which we'll go into at the next couple lectures, improving sleep, self-care overall, taking some time to manage stress, and developing some management techniques overall and improving boundaries. Please use your vacation time. It's important to have not only chronic stress management, but also mental health days. Here are some references that I have used throughout the continuation of my talk, but I'm looking forward to any questions you might have. Thank you.
Thank you, Dr. Fukui. Our next speakers are Brittany Hamasaki and Alicia Faiuaso. They are registered dietitians at Kapiolani Medical Center for Women and Children. They work with both adult and pediatric oncology patients to provide tailored medical nutrition therapy. Brittany and Alicia will be talking about myths and evidence of cancer nutrition, healthful eating for cancer survivors.
Thank you for that introduction. So we're going to get into the presentation starting with the American Cancer Society, nutrition, and cancer risks. So some nutrition factors for developing cancer, as you all know, is probably high salt diet. So that's things like processed foods, any type of smoked or pickled foods, added and refined sugars. So that's a lot of our pastries, sweets, including our Starbucks coffees, has tons of sugar in it. Red meats as well, we want to try to limit those things, especially processed meats. So that includes Vienna sausage, spam, corned beef hash. And then also, like Dr. Fukui mentioned about the alcohol consumption, trying to limit that up to 2 drinks per day for men and up to 1 drink per day for women. And then, of course, again, emphasizing heavily on having a good, healthy body weight, just like Dr. Fukui said. So we want to try to have a lower BMI, so focusing more on that lean body mass, so less fat and more muscle. So getting physically active and having a moderate activity. So 150 to 300 minutes per day or per week is great. having a healthy diet. So a lot of fruits, lots of veggies, and whole grains. So we want to do a lot of less saturated fats. That means less red meats, less processed meats, focusing more on those whole meats and less red. And we'll go into those protein foods a little bit later. And then also focusing more on like our low fat dairy products as well. And then trying to be more rich in our unsaturated fatty acids.
So let's go into the nutrition basics. These are key nutrients that we want you to include or encourage you to include in your diet. So fiber is one of them, and there are two different types of fiber. So insoluble fiber, this adds bulk into your stool. This helps to attract the water and creates that softened stool. So this is very helpful to include when if you're experiencing constipation. It helps to act like a cleaning brush. And so you get that through skins of fruits and vegetables, whole grains, and legumes. Next, the second type of fiber is the soluble fiber. This, the fiber dissolves and creates this gel-like substance, and that helps to, in situations for like diarrhea, this slows down GI transit time, and it also helps to improve your blood glucose control and reduces cholesterol. So sources of soluble fiber include the flesh of fruits and vegetables, whole grain, and psyllium husk. So if you're familiar with Metamucil or Benefiber, that's the soluble fiber. Fiber is also very helpful, is also known as a prebiotic. This helps to create a diverse microbiome and leads to gut health, good gut health. All right. Speaking of fruits and vegetables, some people have asked, our patients have asked, you know, is organic produce healthier than regular produce? You know, evidence has shown that, you know, organic foods may contain higher levels of phytonutrients, and phytonutrients help to fight against cancer. However, you know, it doesn't matter if it does have that organic label, or if it's grown in your backyard, or if you're just, if it doesn't have that label, we just want you to focus on including fruits and vegetables and whole grains into your diet. That should be a central part. Just make sure to wash your fruits and vegetables.
Okay, so now we're going to talk about some protein. So protein helps contain amino acids. So that contains the building blocks for our protein. So that's for our immunity, cell repair, and muscle growth. So during like cancer treatment and things like that, that's usually during the periods of like inflammation, and that's usually when you want to have more protein, as well as when you have an injury. Having too much protein, though, when you don't have that injury or inflammation, can lead to like calcium depletion from your bone and then accelerated kidney disease. So I know earlier we mentioned trying to avoid that red meat. So you want to try to focus more on like other sources. So there's chicken, seafood, eggs, and our low-fat dairy products as well. Those are like our common, like what we think of when we think of protein is like all these meats, but you can also get it from our plant sources. So soy, legumes, seeds, and nuts. So many of you probably are like familiar with these like oral nutrition supplements. These are used a lot during cancer treatment, just due to the fact of high calories and protein in them. So they're helpful in maintaining that lean body mass. However, it can get expensive, as many of you know. So it's always great to choose our foods first and use this more when we're just not feeling hungry, but we still need to get our calories and protein in. So below is like a chart of like more of the more commonly seen nutrition supplements. So things like Ensure, Glucerna, and then Premier Protein. And it kind of just gives you a layout of the calorie differences, protein, as well as carbs. So just depending on what you're aiming for, one may be better than the other.
Okay. Another essential key nutrient to include in your diet are fats and oils. This, you know, with the Western diet or average, you know, American diet, those are higher in fats, especially the saturated fats. And over the years, we've been trying to remove trans fats from our foods. So we want to focus more on those unsaturated fats, so monounsaturated and the polyunsaturated fats. As you can see, there are some examples of each of those fats. So olive oil, canola, avocado, natural peanut butter, also soy as well for the monounsaturated. And then the polyunsaturated fats, we omega-6 fatty acids, those are the more pro-inflammatory. So examples would include cottonseed oil, corn oil, as well as sunflower oil. So you want to limit those and include more of the omega-3 fatty acids. So those are the anti-inflammatory. So examples of those would include cold water fish. So salmon is mostly used, or pretty common to include in most diets, krill, and then as well as marine oil supplements. So algae, if you've heard of some of those. You also get omega-3 fatty acids through fortified foods. So eggs, milk, margarine, yogurt, as well as some fortified juice. There is no conversion required. So these sources are DHA and EPA, so they're highly efficient compared to the plant sources. Those require conversion, so they're less effective. However, they still contain, they're still good sources of omega-3 fatty acids if you are a vegetarian or do not, eat, fish.
So now we're going to be talking about the Mediterranean diet, which kind of pulls in everything we just talked about. So mostly we hear about a Western dietary pattern. So those are the things we want to try to avoid, which consist of the saturated fats, red meats, processed meats, high fat, refined grains. So that's a lot of like our white sugars and white flour. And then added and processed sugars. These are all linked with increased inflammation, cardiovascular disease, as well as cancer progression and reoccurrence. So high quality dietary patterns. So this is what we want to be focusing on. That's a lot of like our plant-based foods. So like I mentioned earlier, lots of fruits, lots of vegetable, whole grains, and of course, trying to avoid those red and processed meats, less of the refined grains and encouraging more of those whole grains. This actually is linked to decreased inflammation, cardiovascular disease, and decreased risk of cancer progression and reoccurrence. So what is a Mediterranean diet really? So it helps, it's going to be a component of basically everything we just talked about. So plant-based, so you want to have your whole fruits, whole vegetables, and whole grains. So whole foods and vegetables, you want to try to do like 3 servings per day. Whole grains, 3 to 6 servings per day. Your legumes, lots of beans and lentils, 3 servings per week. If you get EVOO, extra virgin olive oil, 1 to 4 servings per day. And you want to be moderate in seafood. So especially ones that are rich in those omega-3 fatty acids. So 3 servings per week, and then also having nuts. So that makes a great snack as well, at least 3 servings per week. So what the Mediterranean diet limits, so these are the ones that you're going to be cutting back on. So things like poultry, so up to 1 serving daily. Dairy, again, we want to try to aim for a low-fat dairy, but up to 1 serving daily. Eggs, we want to do up to 1 egg yolk per week. Red meat, this is the one, again, we want to try to avoid, so no more than 3 ounces per week. Sodium, less than 2,400 milligrams daily. And then little to no sweets and concentrated sources of sugar. And then moderate wine intake with meals, not required if you're not a wine drinker, but up to 1 to 2 servings per day.
So does weight status play a role in cancer development? I think Dr. Fukui has definitely discussed this. So I just briefly go over it. So obesity, especially as the central obesity, is linked with increased risk of certain types of cancers. I think Dr. Fukui mentioned about 40%. And so physical inactivity or leading a sedentary life is also linked with an increased risk of cancer. And so overweight and obesity, just to reiterate what Dr. Fukui was saying, that increases the risk of the following. So insulin resistance, increased estrogen production, as well as GERD, those were one of the internal factors. And then of course, chronic inflammation. So if physical activity, weight management are crucial to leading a healthier lifestyle, healthy body weight, and also helps to reduce the risk of cancer. So a couple of things to add into your lifestyle would be aerobic activities. This helps obtain and maintain a healthy body weight, improve lung capacity, and then reduces lymphedema, and then and also helps with dealing with stress and anxiety and depression. So a couple of examples of aerobic activities being running, walking, jogging, swimming, and you can also use an elliptical machine. And then as well as resistance training, weight resistance training, those to help. That will help me improve bone density as well as increase lean body mass. So examples of weight resistance training would be weight machines and resistance bands that you could use. So this is just to show what Brittany was talking about in the beginning. It's just a couple of things, just a reminder. So we want to achieve and maintain a healthy weight, be more physically active, and then to include more plant-based foods and having whole fruits, whole vegetables, whole grains be a central part of your diet. And then of course, avoid alcohol, but if you are to drink, then to limit the consumption.
Okay, so now we're gonna go into like more of our myths. So one of these questions that I hear a lot is, can intermittent fasting enhance the outcome of cancer? So intermittent fasting, of course, is like one of these newer like fad diets that are coming out. And well, there's little evidence that intermittent fasting without any reduction in body weight and proper balanced diet and exercise can enhance cancer outcomes. So can it really help prevent the reoccurrence of cancer, of tumor formation? There's no evidence that this type of diet has beneficial effects after chemotherapy, especially like tumor recurrence in breast cancer patients. And then lastly, can intermittent fasting, can that help prevent cancer? So currently there is no diet out there that can help prevent cancer or prevent the reoccurrence of cancer or cure cancer. So in conclusion, there is currently no data to suggest that intermittent fasting has an impact on cancer outcomes, such as reoccurrence or the development of secondary cancers. However, like we mentioned multiple times throughout this presentation, that weight reduction through physical activity and diet can play a role in reducing the risk of cancer. So overall, just having a healthy diet and exercise lifestyle has a good chance of helping reduce the risk of cancer, which plays a bigger role than doing like an intermittent fasting diet or other fad diets out there.
Okay, another myth to debunk, and we've heard plenty of, is, does sugar feed cancer? So let's get into the facts. So sugar or glucose is converted into energy, which is used to support cell processes, including cell growth. However, there's no strong evidence to show causation between sugar and cancer. Sugar is broken down from carbohydrates, which also include fruits, vegetables, milk, and whole grains. So much of the research shows that sugar's relationship is to the increased insulin levels and related growth factors, which influence the cancer cell production. But it also encourages others to avoid eating all carbohydrates. So that includes those whole grains, fruits, vegetables. So we want to distinguish between those. We want to include and focus more on those quality or complex carbohydrates versus those refined sugars, the candies, the sugar, the chips, sodas. So you want to avoid or limit them. It's also important to spread out your carb intake. So instead of loading it all into one meal, you want to spread it across, maybe having some wholesome snacks in between to help to control the appetite. So wholesome snacks, examples of a protein and carb would be cheese and crackers, or grapes and cheese would be a great example. Some other ones, yogurt's a good one, and granola. We also being more active, as we have mentioned before, and maintaining a healthy weight. So these are things that we want you to focus on for a healthful diet.
Thank you, Brittany and Alicia, for your informative presentation. I would like to take this time to invite Dr. Fukui to join us for questions. Our first question, we did get several about soy in regards to cancer, so I'm going to go ahead and start with that one. There's a lot of conflicting information on soy products, especially for breast cancer patients. What is your opinion, research on the consumption of soy products? Should I limit soy products such as tofu, miso, etc., or can I still consume them? So we did get a lot of similar questions. I can go ahead and answer that one first of all. I think a lot of the misunderstanding about soy comes from animal studies. So these were studies mainly conducted in rodents. So they were given high doses of plant-based compounds taken from soy called isoflavones, and those have estrogen-like activity. And those animal studies did show increased risk for breast cancer. You know, one of the things is that rodents process soy differently than humans, and we have not seen the same results in human studies. The rodents also got really high doses of isoflavones, and it's a lot more than the humans would typically consume in a regular diet. Most of the human studies or population studies we have in regards to soy, actually show either no effect at all or possibly a decreased risk for breast cancer. So we know that soy may possibly lower the risk for breast cancer. It's an excellent source of protein, and it has been linked to lower rates of heart disease and may even help lower cholesterol. So bottom line, you shouldn't have to cut soy out of your diet. Soy also has not been linked to other types of cancers or increasing risk for other types of cancers other than breast. I would advise, though, against soy supplementation. Soy supplements might have higher doses of isoflavones, and we really need more research in that area. Okay. I got another question I was seeing about kimchi. Give me 1 second to find it. There were a few about kimchi. Is kimchi considered a healthy food? It's a vegetable, but with high sodium levels. And someone else said they've heard it's a healthy probiotic, but it's pickled or fermented. Is it healthy or is it too salty?
Okay, I can answer that. So yes, kimchi is a probiotic, but everything comes with a balance. And I read that Dr. Fukui had answered that question already, so thank you. You know, to include more, there are other probiotics as well. And so what I was discussing earlier would be those fiber foods that you would get from whole fruits and whole vegetables. So even though kimchi is a great source of probiotics, you know, you want to have it, moderation is key. If you're seeing so much, like too much salt in your diet, then I would kind of cut back a little bit.
Another question, what is the recommended percentage of daily protein intake for men and women? There have been conflicting info about it these days.
I can answer that. So it really depends on the person's body size. So protein is based off of body weight. And again, it's all estimates. There is no hallmark. It depends a lot of other things too, as well as what other conditions you have going on. Someone with kidney problems may not be the same as someone without kidney problems. So it really just depends on what other conditions you have going on. So it's always good to like ask your doctor first about what types of proteins you can do and what kind of restrictions you can have. And you can always get in contact with a dietitian too as well if you do have any questions. And of course, we can look at what types of factors are going on too. And see what type of protein estimates we have for you, and then also come up with like different ideas with you as well. But just overall having like a real balanced amount of protein, like having like 3 to 4 ounces of protein with each meal is a good place to start for sure.
Thank you. I have another question about alkaline diet or alkaline water. I've heard that people have used that to prevent cancer or fight cancer. Would you recommend drinking alkaline water or changing your diet to an alkaline diet to fight cancer or prevent?
So I'll take this. So there haven't been any studies actually looking at alkaline diets and prevention of cancer or treatment of cancer. In fact, our blood is at a pH of 7.4. So no matter what you put into your stomach, your blood is going to be buffered. So having something expensive really probably won't help outcomes overall. And it could end up being just more expensive than anything else.
Thank you. I had a question about Ensure. I was trying to find it. There it is. It seems like the primary components in supplemental drinks like Ensure are ingredients like corn syrup or other sugars and vegetable oils. Are those considered healthful ingredients? And what about the sugar content of some of those drinks?
I can answer this one. So yeah, I know a lot of concerns are like corn syrups and all these added sugars, especially with Ensure. So I know I've seen another question about Cape Farms, so that kind of can tie in together. So if you're concerned about the corn syrup and things like that, feel free to use things like Cape Farms or Orgain, something that use a little bit more organic products. But do be in mind that Ensure and things like the glucerin or Premier Protein, they are made to help kind of act as like a crutch when you're not eating, right? So if you're able to eat and things like that, that's what we want to focus on. So more like our fruits, vegetables, getting our proteins from like good sources like our chicken, our seafood. So you can avoid those corn syrup like things and things like that, and all that high sugar. Those are really meant to be more of a supplemental when you're not eating. So I wouldn't worry too much about that, especially during like this time of survivorship. I would focus trying to get more of that whole grains, fruits and vegetables, our healthy proteins in. And then if eating for sure is a concern for you and you are concerned of things like corn syrup and other things, Orgains as well as Cape Farms is a great option that don't contain those like corn syrups. But again, you still want to watch our sugar intake. So that's why the Ensure and Premier Proteins all have like a high amount of sugar. It's because it's made to like almost supplement a meal. So again, if you're not eating really well, and that's something you should bring up with your doctor too. And that's usually when we can get involved as dietitians, is kind of talk to you and figure out other ways that we can help you besides the Ensure.
Thanks, Brittany. And somebody else did ask a question about Cape Farms, so it's great that you happened to mention that when you were answering the prior question. So another one that I have is, what is the evidence that alcohol can contribute to cancer risk? I've heard that red wine is heart healthy. How many drinks are considered safe?
So I can take that one. So there are certain cancers that can be linked to alcohol use. It's usually of the GI tract, so esophageal, stomach cancers. We're not completely sure about the mechanism, but probably because of inflammation. We know the recommendation is 1 drink a day for women and 2 drinks for men, but of course, less is better. So red wine is probably a healthier option rather than more hard alcohols. But the type of mechanism for how cancer is developed with alcohol is probably through inflammation.
Thank you. I did want to tack on to about, the moderate alcohol intake and the 1 drink for women and 2 drinks for men. In regards to breast cancer specifically, we do have some data to support an associated increased risk with even moderate intake of alcohol for breast cancer. So one alcoholic beverage daily associated with about a 10% increased risk for breast cancer, 2 to 3 alcoholic beverages per day, about 20 to 30%. So that risk increases, with more daily use and then higher intake amounts. There's also risk in regards to, stomach and liver cancers. That risk is much higher if you drink 3 or more alcoholic beverages per day. With colorectal cancer, it increases by about 1.5 folds if you don't drink at all. But otherwise, yeah, in regards to like heart health and antioxidants, we know that red wine does have some antioxidants, but we also know that alcohol can lead to a lot of other adverse health effects. So, there's other places that are much safer to get antioxidants like fruits, vegetables, even grape juice. Somebody's asking, are too much fruits not good because of high sugar content? And what other fruits might have lower sugar content, such as berries, possibly?
Yeah, I can answer that. So the recommended or amount of fruit that you would like to have in a day would be 3 to 5. The concern for sugar, if you have more fiber in the fruits, so let's say pineapple, that would really help to lower the sugar, how could you say, not absorption. Brittany, if you want to help me out on this, that would be great. But so either more fiber, or you can include more of, like what Valerie was saying, fruits that have more water content. So those berries would be a great option versus those higher glycemic fruits.
Yeah, it takes the fruits with more fiber take longer to break down, so it raises your glucose slower than the fruits with less fiber to add on to her.
Thank you. I have a question specifically for colorectal cancer survivors. And since we're talking about fiber, she was saying that colorectal cancer survivors usually cannot tolerate fiber and whole grains in the same way. And in fact, might be recommended a low residue diet after surgery, which may contain some more processed grains and not whole foods. Do we have any advice from our dietitians about this situation?
Yeah, so I can take that question. So colorectal cancer, yeah. So again, we do recommend a low residual diet just based off of depending what type of surgery you have and how much is removed. So again, processed grains and whole foods are just one part of the diet, right? So you can definitely do other things that we mentioned in the diet. So protein, you can also do, again, fruit, less of the fibrous fruits, removing skins and things like that. So even though we want to stay away from like the whole grain foods, there are other parts that you can adjust to. So even though one part is again not the best, you can focus more on those protein foods. And then there's other things too that help with digestion, like chewing your foods really well, trying to go for the softer foods. So that helps with digestion as well. But just trying to avoid those whole foods is one part of the diet, but there is other parts that we focus on, having more protein and things like that. So you can cut back more on having those processed grains and fill your plate more with those healthier proteins.
Thank you. Another question about keto diet. Is that a good diet to consider?
I can take this. So for a keto diet, it's a therapeutic diet specifically for epilepsy. And so lately people have used keto diets as a fad diet, and it's not as sustainable than a whole food, wholesome diet to include all the fresh fruits and vegetables. So more the keto diet, just to, if some don't know, is more of a higher fat, less carb. And so we definitely want to focus more on the whole foods diet than a non-sustainable diet where you're getting good results really quickly and it won't sustain long, and you might just end back where you started before. So those are my thoughts.
What supplements are recommended to prevent cancer or after diagnosis?
I could take that. There really aren't any supplements that are recommended for prevention. We just in general say a heart healthy diet has plenty of fresh fruits, vegetables, and vitamins. You don't need supplements. But for elderly or people who might have a more restricted diet for whatever reason, it's good to maybe potentially get some supplementation that way. For cancer survivors, same thing. There isn't any supplement that was been shown to help prevent cancer recurrence. But again, a generally heart healthy diet is what's recommended.
Great. I think we're getting to the end of the questions. I do have one about canned tunas. Any thoughts about that?
I can take this one. The canned tuna is fine to have. There is like two different ones, though. It's usually in oil or in water. So if anything, that's important to look for. You want to get the one in water. The one in oil tends to have more fat because the tuna is sitting in oil, but it's totally fine to have. And the nice thing about canned tuna, it's cheaper than going out to buy fresh fish, but you're still getting all the nice omega-3s and things like that in it. So canned tuna is totally fine to have. If I always recommend to is if you accidentally buy the one with fat, you can always return it to the store and swap it out for the one with water. So just always try to get the one in water.
They also have those options, the tuna that's sitting in extra virgin olive oil. So you can find those on the shelf as well.
Great. I have a question about juicing. I've been juicing vegetables to get more nutrients due to stomach cancer surgery. It was very helpful. What is your take on juicing to maximize nutrients?
You can take this one. So juicing, if it's tolerable, the nice thing about juicing is that you're usually doing it without skin. So this person said like due to stomach cancer. So if it's more tolerable, that's a good way to get in like your fruits and vegetables. And especially if you're tolerating it, that's great too, because you're getting in fruits and vegetables while being able to tolerate it. So that's fine. Again, and that's even though we talked about sugars, if you're juicing like vegetables, you can also juice like fruits too, so that's great. So if that's a way to get in your vegetables, that's good to get in nutrients that way as well. But again, you don't want to just juice and then forget about the other components too. Yeah, so make sure you get in some protein in there too.
I think this is our last question. What about plant-based milks? Oat, soy, almond, rice? Any thoughts on those?
I can take this. So for plant-based milks, if let's say like whole milk is giving you some stomach problems, or if you're a vegetarian, then plant-based milk is a good source of calcium. So it's really up to how your preferences, what your preferences are.
Thank you so much to our panelists who took the time today to provide insights to our viewers and patients watching at home. We hope you found today's program informative and useful in your efforts to prevent cancer through nutrition. As you've heard throughout today's program, Hawaii Pacific Health offers comprehensive services that can support the medical needs of you and your family. For virtual care via video or phone in-person visits, or in-person visits, we are here to keep you healthier. If you have any questions regarding our services for today's webinar, please visit hawaiipacifichealth.org. Before you sign off, we'd appreciate you taking a minute to complete tonight's post-test. Please scan the QR code on the screen or follow the link in the chat. Thank you all again for joining us today, and we wish you a safe and happy, healthy holiday season.